Today, I want to talk to you about something that I think is important, questions to ask your doctor before you have a breast augmentation. So the first thing you want to know about your doctor and, do your research, ask them if you can't find it, is what are your credentials? The important thing you want to know is if they are board certified or board eligible by the American Board of Plastic Surgery. That's important. What does that mean? It means they've completed their full training in plastic surgery at a program that is recognized by the American Board of Plastic Surgery, and they've either completed or in the process of completing their board certification with the American Board of Plastic Surgery. It means they've trained in how to do the procedures, how to deal with any complications that may arise. They've been trained by many experts in the field, and this is recognized by the American Board of Plastic Surgery. There's doctors out there who might say they are board certified or board eligible, but make sure that is in plastic surgery by the American Board of Plastic Surgery. A doctor out there could be a dentist, a pediatrician, and be board certified in that specialty, but not in plastic surgery. I did a fellowship in aesthetic surgery. That's a fellowship that's recognized by the American Board of Plastic Surgery, and it's an extra training that I did to specifically focus on aesthetic surgery. But there's also cosmetic surgeons out there who did maybe an OBGYN residency or just a general surgery residency, and then go on and do a 1-year training in what they call cosmetic surgery. And that's the only training they have in doing this type of surgery. And you just want to make sure that you know the credentials of your surgeon. Another important thing is to know how experienced your surgeon is and how many breast surgeries they've done. Now, if someone were to just ask me in clinic during their consultation, how many breast augmentations have you done? I would not know that number off the top of my head. And that's because I've done a lot. I just don't know that number. Can I get the number? Yeah, of course. I've got all my records from every surgery I've done, and I can get that number. But make sure that they've got lots of before and afters that you can see, immediate results, long-term results, short-term results, all different types of results that they've done. Make sure that it's not just their one best surgery that you can see out there, because that's, something that you can do on a website. You can just pick your 5 best surgeries, put them on your website, and that's all you've done potentially. But make sure that you've seen more than just what's on the website, and that can really help you, guide you, make sure that the results that they're getting are the results that you're going for. Another thing to be aware of before a breast augmentation is the different options for breast implants. Don't just go to a consultation and just be satisfied with the surgeon telling you this is exactly what you have to have. This is your only option. There's lots of options out there. Now, the surgeon, I have a preference for what I like to do and how I like to do things, but my goal is to help accomplish your goals. That's why you're here. That's why you're at the consultation with me. I want to make sure that we're accomplishing your goals, getting the look you like, and I will make my recommendations based on those things that you tell me and that we talk about. Different options for implants. There's silicone implants, there's saline implants, there's different cohesivities to the silicone implants that we use these days, or how stiff they are, how teardrop they become, or how much upper pull they maintain. There's different profiles. One specific company might have 5 different profiles. A profile is just the shape of the implant. To me, that's really the most important part of the implant, the dimensions of the implant, the width and the projection. And then, of course, we've got tons of different volumes from small implants to large implants. So there's lots of different options that we can use to help accomplish your goals. Important to know those things and know why we're choosing the different things. And that's why when I do my consultations, I go into extreme depth, probably more the detail than you want to hear, about why we're choosing one thing or another thing to help you accomplish your goals. For some technical things that you might want to know about your breast augmentation surgery, there's things like, where's the incision going to be, or the cut and the scar in the end, or where's the implant going to be placed. Those are just important things. Different surgeons have different techniques and why they use different things. For me, most of the time I'm putting a small little 4 centimeter incision in the crease of the breast, under the breast. I've got reasons why I like that. I feel like I have good control there. I can put the implant exactly where I want it. It's easy if we ever do a replacement. You don't have to have a new scar there. But we could talk about different options when we talk about your breast augmentation, and where the implant goes is important too. You can put it under the breast, under the muscle, or there's even a layer in between those two, under the strength layer of the muscle, which sits on top of the muscle. Most of the time I'm putting my implants under the muscle. For me, that is the best look. It allows me to control things. It allows the most support for the implant in the long term, where the muscle's holding up the implant because the capsule forms to the muscle instead of the breast. But again, different people have different needs. And again, this is something we talk about during consultation and figure out what's gonna be best for you. Another technical aspect of the breast augmentation is just the length of time it takes for the surgery to take place. Breast augmentation is on the shorter side of some of the surgeries that we do. There's some surgeries that can be much longer, and it's important to know that and make sure that you're healthy enough for those very long surgeries. But even for a breast augmentation, it's about an hour surgery, give or take. Some people it's less, some people it takes a little bit more. I always tell people, plan to be here about a half a day. We'll have you get here long before surgery to get you ready, make sure that you're prepared, and then you're gonna have to wake up and recover for a period of time after surgery. So it's about a half a day that you're here for breast augmentation. Something else you might wanna know about your implants is the warranty on the implants. Most of the time people don't need that warranty. But if it does become a factor and you need that warranty, you want to know what it's covered. We've got different kinds of documentation we'll give for the different manufacturers. All the implants we use do have a warranty. It covers things like rupture, capsular contracture, BIA, ALCL, and different things, and those are covered for various lengths of time. Again, it's all documented, and we've got documentation that we can give you so you'll know about it, if it's covered or not, if you have an issue. But that's something we'll talk about and give you all the information on when you come in for your consultation. When will your follow-up appointments be? You want to know that, one, you're going to have follow-up appointments. You don't just want to have your surgery and never see, your doctor or the team again. But when are they? How frequently are they spaced out? Are you going to be, am I going to be available for you if you have issues in between your appointments? And those are things that I think are extremely important. For a breast augmentation, I'll usually have an in-person appointment at 1 week. That's going to be the first time I will plan to see you in person. But I tell all my patients, I stay in super close contact after surgery. I want to know anything that's going on, any questions you have, any concerns you have, something you see that you're not sure if it looks right, or something you're feeling that you're not sure if it's right. Let me know. I want to be there for you. I'd rather tell you everything looks fine, we'll keep an eye on it, rather than something be wrong we need to address and now we're chasing our tail because we don't know. So not only are we going to have our scheduled follow-up appointments, but for me, I make sure to stay in very close contact with my patients, and that's something that all my patients know and are happy to have. Another important thing to be aware of is just what you can expect to feel after surgery, or what kind of pain you're going to have, discomfort you're going to have. Each surgery that we do is different, of course, whether it's a tummy tuck, an arm lift, a breast augmentation, a breast lift. Each of those is going to have their own kind of pain profile. But we're talking about breast augmentation here. The incision that we make doesn't really hurt. Nobody really ever complains about the incision that we make from this surgery. What you really feel after this surgery is the stretch from the muscle, because I do put my implants most of the time under the muscle, and your muscle is getting a little bit of stretch from that implant. So it feels like a bad gym workout that you did. But that goes away over a period of time. At about the 1 week mark, we're gonna have you start doing breast implant massage, pec muscle massage, stretching and range of motion exercises to help loosen that muscle up. And once the muscle and the skin loosens up, you're feeling pretty good. And even before it does, things feel a little tight, but you can do your day-to-day activities, wash your hair, kind of fend for yourself around the house. Breast augmentation doesn't tend to be one of the more painful surgeries. We'll use a special block during surgery to help with some of the pain and take that away during that really acute period. The bigger the implant we put in, the more stretch there's going to be on the muscle. So that's just something to be aware of when choosing implant size. Smaller implant, a little bit less stretch. Bigger implant, more stretch on the muscle. So you might feel things a little bit more with the bigger sized implants. but overall not too painful to surgery. An important question is, how long are these breast implants going to last after I have my breast augmentation? That's something that I hear all the time, and you'll read different things on the internet or hear different things on social media. The average length of time that the implants last, or before we replace them, is about 10 to 12 years, but that's not meaning we have to replace them in that period of time. The FDA says they're not meant to be lifetime devices, meaning you're not meant to have them today and have them forever. So if there's nothing wrong with your implants, you've been getting your regular screening with MRI or ultrasound as recommended by the FDA, you're seeing your surgeon regularly to make sure everything's looking and feeling good, you can keep them for as long as they're good for. Now, if you're gonna have something else done, because the body's gonna continue to age, at some point you might need a lift, you might want a different size. If we're already going in for something else and it's been about 10 years, then we'll recommend replacing the implants. And that's because over time, the implant shell is rubbing together, it's getting a little bit weaker. The chances of something happening are increasing over time. And about that 10 to 12 year mark is when you're gonna potentially want something else done. You're already going to sleep, you're already having surgery, then we'll recommend replacing the implants at that point. But there's not a definite, you have to replace the implants at 10 to 12 years. I wouldn't recommend just going to sleep just because the implant is a certain amount of age. Now, some people have anxiety about how long they've had the implants in and they just are worried something's gonna happen. That's a perfectly fine reason. If that's something that you want done, we can talk about that. But that's kind of the average amount of time that implants will last. Nipple sensation is something else that you should be aware of after surgery. Now, with breast augmentation, we're not actually cutting the nerves to the nipple. With some other surgeries like a lift or reduction, sometimes some of the nerves get cut, but even with most of those surgeries, everything pretty much goes back to normal over time. With breast augmentation, it's not that things are getting cut, but because that implant is putting some stretch on the nerves, and nerves don't like to be irritated and stretched, sometimes there can be some temporary changes to nipple sensation. Some women get decreased sensation after surgery, some women get increased sensation after surgery, but most of the time, over a period of weeks to months, those will go back to normal if that happens. Now, it's not 100%. Has anybody ever had permanent changes to the sensation of the nipples? Yes, nothing is 100% in medicine, but the majority of the time, either there's no change to the sensation at all, or if there is, it's a temporary change that will go back to normal over time. How is aging and pregnancy going to affect the breast augmentation results? I say that your body's going to continue to age just as it would if you didn't have the breast implants, except now there's a little bit more weight in the breast. I always tell my patients the enemy to breast is gravity, weight, and time. Gravity's always going to be here. Times, unfortunately, we can't stop. We're going to continue to age. And now we're adding a little bit of weight. So can the implant exacerbate the hang of the breast and the effects of gravity over time? Yes. And depending on the breast implant size, it can affect things more or less. And depending on your tissue strength, that can affect things as well. But your body's going to continue to age as it would. This doesn't stop the aging process. So over time, your skin's going to get more lax, lose some of its strength. At some point in your life, you might want to lift. And same thing with pregnancy. Pregnancy changes to the breasts are going to happen just as they would if you didn't have the implant in. So they're going to get bigger, they're going to stretch, and then depending on your genetics, things might rebound back and go back to how it was before, or they might not, and you might need or want to lift at some point. Those are just a number of the questions that are important to know before you sign up for a breast augmentation surgery. But you might have individual questions that I didn't answer, or of course there's tons more questions out there. If you've got some important questions that you would like me to answer, leave them in the messages below and I'll get back to those as soon as I can. Or you can feel free to visit our website or call our office. My name is Dr. Jeremy Bosworth, and I'm a plastic surgeon and fellowship-trained aesthetic surgeon at North Texas Plastic Surgery. Make sure to like, comment, and subscribe so we can keep making these videos.